Welcome in. I'm Collette Wieland alongside Dr. Stephen Camarata. Steve is an internationally recognized expert on child development with a special skill set of working with children who have speech and language delays. And today we want to give some guidance for parents and talk about what the next steps might look like if your child is a late talker. So thank you for being here with us. Let's do that, Steve. Let's start with, what should be the first step, I guess?
So always when your child's late talking, check with a physician. You want to make sure that there's not some medical reason that's holding them back in terms of their development. Usually there is nothing medical, but sometimes there is. We've had things like seizures. Some kids have had brain tumors. There's been things like that. Very, very rare, but you never want to assume anything. You want to make sure that medically they're healthy and ready to learn.
Rule that out.
You want to rule out a medical condition. The next thing you do is take them to an audiologist to make sure. An audiologist is somebody who's a hearing specialist, and you want to take them to an audiologist to make sure that their hearing is okay. So one of our markers for late talking is hearing loss or deafness. We have universal screening now for hearing loss when children are born, but there are conditions that can happen later on, things like meningitis. Sometimes there's other medical conditions that cause hearing loss. So you want to make sure that they're medically healthy and that you've checked their hearing to make sure their hearing was coming in, what you're saying to them.
Which is amazing. Amazes me that as a newborn, they do that infant screening, and they have machines that can do that.
Yeah, so it's really,
cool.
It's really cool. And me, I always have stories. And when I was a postdoc at University of Arizona back in the mid-1980s, that's when they were doing that. And so the way they do it is they put in a sound pulse into the ear, and then if the cochlea is receiving the sound, it actually sends back an echo. And so it's actually a tone that's put in the ear, and then it comes back. And what comes back, they record with a microphone, and they can tell if the cochlea is working properly or not based on that.
And that's
called otoacoustic emissions. It was developed in the 80s, and then the universal screening came in into the mid to late 90s. So it took about 10 years to work it out so that you didn't want to have a lot of false positives where you were making parents worry. So it took a while to develop it. But yeah, anyway, it's a neat technology. So the baby doesn't have to cooperate. They just can put that pulse in there. And then if they're worried that they have a hearing loss, then they can actually use electrodes and what's called auditory brainstem response, or ABR, to make sure that once it gets into the ear, it's actually getting into the brain and going up to the auditory cortex through the different neural pathways. So the technology is great, and it's not 100%, but it's really good and it's very accurate. So.
And they can do that, at the newborn screening.
They do it in newborn,
Can
they
do it later then if your child may have had some illness or some event that? There's different ways of checking hearing, and an audiologist can check hearing at any age level. Okay. So there's different technologies they can use along the way. Yeah. So your child's born, maybe they find something, maybe they don't. And here we go to what's the age? I know if you're just joining us for the first time, we'll reiterate, because we've said it before, kind of the age where late talking really is something to be concerned about or to wonder about.
The average time of first words coming in is 12 months, but the average range actually extends to 16 months. So normally you start thinking about it, and unless there's something else drawing your attention, like the child's withdrawn, isn't responsive in other ways, but as long as they're otherwise developing typically, then normally you'd want to hear first words by around 16 months at the latest.
Okay. When you first see people come in with concerns about their late talking child, what's the emotional state for those parents?
Well, parents are terrified. It's interesting. I have my little grandson staying with me right now, and it's such a delight. He's going to be 11 months old in a little bit, and he's babbling and making word-like productions, and so if he weren't and he were quiet, then you can imagine that parents would be very, very nervous about that. So he's showing signs of getting his first words, and probably will in the next few months if I can look into my crystal ball. But it's one of the things that you really notice about toddlers, is whether they're talking and interacting. It's something very human to communicate. And so when it's not happening, then that can really be a concern. And then, parents are very, very concerned about autism. It's very highly publicized, and it's great to have public awareness. But on the other hand, it's also created maybe some anxiety or nervousness that the child isn't talking, could it be autism? So usually the parents are quite nervous. I will say that Sometimes families will come in and one parent is concerned and one isn't, so that happens too. But normally when a child's 18 months, 2 years of age, and they're not talking, then they're quite concerned about what it is and what it can mean. Not only right now, but down the line. Parents are always thinking about the future too, education and things like that. So it's a very salient thing, and parents are often worried about it.
If you have a firstborn, no problems, right? Talking and hitting all the typical developmental milestones. But then your second one comes along, you're like, wait, this isn't what's happened before. This is not what I'm used to.
Yeah.
And that got me thinking, are there any studies or is there anything to say statistically where a late talker falls in the family line?
So it's certainly true that it's less common in firstborns, and probably one could argue it's because they get all the parental input. That's not to say parents not talking to their children cause late talking. It's just that first one really garners a lot of attention. And there's other things too socially that happen in that first one that the later ones don't get quite as much of. But long story short, it's hard to do really good controlled studies because you can't really randomly assign parents to have 1, 2, 3, 4 children. So
you're
it's
going to be in the study. You're
right. Yeah. You're going to have 4 kids, you're only going to get to have 1, whatever it is. But all that aside, from, a population health kind of standpoint, normally the first child is less likely to be late talking. But if a first child is late talking, it's not necessarily a sign that something's wrong either. I wouldn't want people to hear that.
Sure. Yeah. No, I was just thinking.
Yeah. I'm a second child, so.
Okay.
According to my mom, my older brother was an early talker, so that made her panic more when I wasn't talking.
And at what age, just to remind folks that you yourself are a late talker, at what point did your family notice your language burst finally?
Yeah,
happen?
So it's credible. I mean, it's a long time ago, but it's credible because my mom talks about me starting to talk when my sister was born, which was when I was around 3.5. Okay. And so probably true because that's a marker for that. And she did bring me to the pediatrician when I was 2.5, worried about my talking and not talking, and the physician just told her that not to worry about it. And back then, wait and see was kind of the main thing they did because they didn't really do a lot of intervention or assessments back in the late 1950s, early 1960s. They didn't really do a lot of assessments until you got into school. So having a 2.5-year-old come in at that time, there wasn't this big focus on early identification that we have now.
Well, at what point today, in today's world, should people seek qualified professional help?
So the American Academy of Pediatrics, recommends mentioning if there's difficulties at the well baby checks, and so certainly at the 18-month well baby check, if you have a concern about your child's development, that'd be a time to express it. And certainly at the 2-year well baby check, you'd want to talk to your pediatrician if you felt like there was a problem. And of course, you could seek out a speech pathologist or other kinds of services if you had concerns even before that. So, but normally the normal way it's going to work is that when you go in for a well baby check, you'd have a conversation with your pediatrician if you had concerns about it. And again, if you're nervous about your child's development, then you can always reach out to a developmental specialist. And if it's about talking, then a speech pathologist would be somebody you could reach out to who maybe is a specialist in early identification and assessment.
You and I have talked in previous episodes about symptom versus a stage.
Mm-hmm.
So if you want to deep dive there, go back onto
Yes.
the YouTube channel. You'll come across some of those episodes, but we're going to brush briefly about that now. So if you're thinking it's just a stage, meaning your child there's nothing else, no other underlying medical conditions, is there confusion then as to when to go? Because if it's going to happen, right, and you just kind of have to wait
so I think
it out.
that's a very, very good question. So in over half the cases of an 18-month-old or a 24-month-old, the late talking is going to be a stage. They're going to go on and have a language burst or language development. We have a lot of good studies over a long period of time to show that's the probability of it being a stage. But that doesn't mean that any parent should assume that's what it is. In other words, you'd want to follow the normal course of getting an assessment and talking to the physician about that, at 18 months or 24 months, whenever you have a concern. Now, the key thing is getting a good diagnosis to know if it's a stage or a symptom, or to have good reason to believe. There's assessments we can do to kind of rule out things like autism, intellectual disability, or other things that are longer lasting conditions than transient late talking, or where they're going to normally kind of catch up and develop. So, but anyway, to answer your question directly, you should never assume it's a stage or a symptom. Go in and have an assessment and have somebody that's open-minded. The key is getting a good differential diagnosis. That's foundational, and that's what we want to emphasize. But don't wait out of fear. Go in, yeah.
If your child is young and you notice that they are not hitting the developmental milestones, the typical developmental milestones like their peers, are there little things that you can do at home before you go seek help?
Well, I think, again, I don't want to dissuade anybody from going in.
Sure.
But sure, we have lots of studies to show that if you start engaging your child where they initiate any kind of vocalization, or if they point or look, and then you let them lead, and then you say something when they do that, that's very effective in encouraging development. So a lot of times, what happens is parents are really nervous, and so they might have a picture book, and they'll say, "What's this? What's this? What's this?" And they're trying to kind of pull the words out of the child, and it's fine. I don't want to have anybody have guilt if they did that, but it's actually going to be more helpful developmentally if you actually wait for the child when they look at the picture, maybe look at you, or they look at the picture just unto itself, and then say to them, "Oh, it's an elephant," or it's a car, or whatever it is. So you want to wait for them. It's that patient part that's going to be helpful. But absolutely, every late talker, whether it's a stage or a symptom, the parent should be given some strategies to support their child's speech and language development and communication development. So you'd always want to do that no matter what. So sometimes there's kind of a controversy about this idea of wait and see, and I don't recommend that. We always, whether it's a symptom or a stage, there's no downside to getting in and teaching the parents how to interact with their child that we know is going to facilitate their development.
Well, that's what I was going to ask. There's being proactive isn't going to hurt you in this case.
Not in that way. Now, if your child's misdiagnosed and put into the wrong treatment, that could be not helpful.
Okay.
So one of the kind of standard recommendations, for example, for autism is to have the child in 40 hours a week of very structured behavioral intervention where they're being prompted a lot. Maybe they're being given food rewards and things like that. And there are some children, a very few children with autism where that could be beneficial. Although we're not sure about whether 40 hours, it might be too much. We don't know what the best dose is. There's a couple studies to show that 10, 15, 20 hours seems to have the same benefit as 40 hours. That's something where the evidence base is still emerging. But you would never want to do that with a child who's not autistic. That would really be bad for him. It completely derails and alters typical social development and typical language development. So it's fine to do what we call naturalistic intervention that parallels how parents interact with their children, and we teach parents how to do that in a way that's encouraging and nurturing and positive. But you really don't want your child in the wrong intervention. So it's not that everything is okay. You want to make sure you get a differential diagnosis and you're getting the right treatment for what it is that your child is showing or what the late talking actually means. And again, even if it's a stage rather than a symptom, you can do things to kind of accelerate their speech and language development. And we always do that.
So, kids don't come with a handbook. You kind of have to figure it out.
They
as you
do
go
now,
along.
right?
There are great books out there, yes. But you know what I mean. You just kind of have to figure it out. But there are places and there are people who will teach the parents what to do at home.
Yeah, over the last 20 years, we have a lot of studies, a lot of literature, and so we really do have a good sense of how to empower and encourage and kind of coach parents into what are encouraging and supportive interaction styles that are going to help their child learn to talk.
What's a reasonable amount of time to do that at home before you're like, listen, this is beyond what I'm capable of doing?
So I always want every parent to do whatever they're comfortable with. So one of the things I worry about is if somebody says, we want you to do X, Y, or Z, and maybe there's lots of kids at home, maybe there's the parents are working, and then that's one more thing on the guilt train. We never want to do that. So what I always try to do is start with kind of taking a dedicated half an hour in the morning when the child gets up, and you can do this while you're feeding him and taking care of him. And then, a half an hour like bedtime routine, pre-bedtime routine, where you're really focusing and implementing these strategies that are facilitative of speech and language development and social development. And you can kind of do that and see how comfortable you are. If we can add more than we'd want to, but if you can't do that much, that's okay too. The reality is we don't have good studies about what the optimal dose is. So these are kind of rule of thumbs, clinical things we recommend, but I can't point to studies that say, oh, you need to do 30 minutes in the morning, 30 minutes in the evening to get maximum effect. They're kind of just guidelines that we have developed, but they're not at necessarily clinical trials to show that an hour is better than a half an hour or something like that.
Basically, fit it in where you can as best you can.
Just,
and don't feel bad if, oh my gosh, you missed Monday.
No, exactly. Yeah. I mean, life happens, and, there's just so much to being a parent, and especially with little toddlers there. There's a lot of work, wonderful, but a lot of work.
Yeah. So, we're talking daily, building it into your daily routine, but
Absolutely.
What about the length? So we're talking weeks, months, what's reasonable amount of time there before you're like, okay.
Well, the thing that's really awesome about this kind of we call it transactional learning, where you're actually attuning your interactions to the child, is that they'll automatically kind of lead you through development. So you keep doing that through preschool. And what's going to happen is, so like with my little grandson, he's in my mind right now because we've had him for the last couple of weeks, and it's just wonderful.
He's adorable, by the way.
Well, yeah, we have independent validity for that. Yeah, he's really special in so many ways. But right now he's starting to develop what we call canonical or syllabic babbling. So he'll say ah, and then I'll say ba, ah ba. And so now he's starting to put his lips together, and and so what happens is, and then pretty soon when he has words, then he'll say a word, and then I'll say the word back to him, and I'll probably put a gesture with it. Like right now, he's actually getting ready to develop hi, which is, I think, is going to be a cool first. Well, Papa's the best first word because that's my name, but I'm shamelessly not trying to promote Papa. But anyway, all teasing aside, it looks like he's going to develop hi. He puts his hand up and he smiles, and he's starting to kind of move his mouth in a way that suggests to me he's going to say hi. He says ah right now. He goes ah like that. But he's going to be once you attune yourself to the child, they elicit it. And then when he gets to one word, he gets to two words, and it's very natural then to add, for a parent to add another word. There's a really great study out of the 70s where the lead author was a guy named Ernest Mork, who was a really good observational psychologist. And basically, what he showed is that the parents just naturally stay about one word ahead of their child. So when the child has one word, they're using two words, and the child has two words, they're using three words. And that study's really held up over time. So parents naturally, when they're attuned to the child, will give them what they need for the next stage. So that's the cool thing about this. Once you attune to the child, it's self-sustaining. And so you just keep doing it. And then, when a child gets to be more conversational and they're in school age, then kind of the whole thing shifts. But through toddler and preschool years, this approach is very effective in accelerating and encouraging speech and language development and social development.
When you're working with parents and they're doing the things at home and you're seeing them in a clinic setting, what are some of the big red flags, the warning signs that something is not right?
Yeah, so I think, again, if you're thinking about this in the symptom of the SAGE model, there'll be kind of two main areas. So some children, and this is a sign of autism, they're not going to be interacting or eliciting responses nearly as much as late talkers, where it's a symptom, or it could be a language disorder, speech disorder, something else. So a child with autism has a reduced motivation for social interaction. And then they also have a heightened interest or reliance on routines. And so those are things that displace this natural attunement that I've been talking about, this transactional learning. And so they're going to be off in a corner playing with a toy. And then when a parent approaches them, they may actually turn away, or they may actually, not interact. And oftentimes when they do interact, it'll be something for a primary need, like they're hungry or whatever it is they know, to go to the parent to try to gain that. But once that happens, then they're going to terminate the interaction. So when I'm working with families where the late talker is autistic, then I'm really working with them to find any tiny clues of the child's motivation to be social, and they're very different. They're not the ones that a parent's naturally going to notice, and so that requires a lot more support. So I don't like to really think about red flags, but one of the things that you'd see is that the child is not interacting, they're not looking at you, they're not engaging in play with you. They're really kind of isolating themselves from other people, or it could be siblings and so on. So that's what you're looking for. And then one of the things, I also do studies of speech, language, and social development in Down syndrome. And so a child with Down syndrome is also going to learn more slowly. And so whereas like with little Ellis, when I can go back and forth with him on these syllables, and within a few weeks he'll start modifying what he does, and as we're attuned to each other. A child with Down syndrome, it might be 3, 4, or 5 months or longer. So the child with Down syndrome is going to learn in a similar way, but it's going to take a lot longer, and that's true for intellectual disability. So they learn kind of in the typical way, but it just takes longer for that to get in. Then my own late talking son, Vincent, whose late talking was a symptom of language disorder, which is another type of symptom or diagnostic category. When I was teaching vocabulary, like normally you can show a child a vocabulary word, and within usually 10 presentations or less, they'll get it. It took hundreds of presentations before he'd remember it. So he was slower learning. His visual, spatial, and other learning was on time, so it wasn't like he had a broad intellectual disability, but his language development was very slow. And so it's that way with intellectual disability or with language disorder. It takes longer. So it's the same learning pattern, but it just takes a lot longer, a lot more presentations.
For a late talking child who is going through a stage, how long does it typically take to work with them before they're caught up, if you will, with their peers?
Yeah, there's it varies, but there are some late talkers who they go all the way to 4 or even 5 years old, and they suddenly catch up. Very, very uncommon. Normally by the age of 3, or like in my case, 3.5, that's when there's going to be a burst, and you're going to see where that happens. Now, I also want to say that when it's a language disorder, or even late talking more generally, there'll still be little things that are different about the child. So many late talkers are more mathematical, visual, spatial, analytical, and that's going to be a temperament thing that they have, and it's not clinical. But it's going to be a little bit of a difference, and they might have a smaller group of friends that's more specialized, things like that. So they won't be clinical. There's really a great set of longitudinal studies done by Leslie Lascorla, where she got a group of late talkers and when they were toddlers and followed them all the way through their teen years. And so they caught up in their language ability, but they were always slightly behind their peers, and their non-language achievement and things like that was ahead of their language-based achievement. So if you think about math, there's math computation, there's math word problems. So they'd be better in math and less good in word problems. But they were the typical range in all the measures by the time they were teenagers.
Okay. So
does that make sense?
It totally makes sense. Yeah. If it's a symptom, though, it's not going to look the same for every child.
So like with my son, he had an IEP, individualized education plan through middle school until he was in high school, and it took him a lot longer to learn how to read. And it just was we had to really do a lot of things with him to basically treat him and improve his language and his receptive language abilities, and then his reading later on. And that's not unusual when the late talking is a symptom.
And if it's a symptom, there's no broad way to say it's going to be 2 years before they,
we actually have some prognosis.
You do?
Yeah. So if a child has an expressive language disorder, so they're a late talker, very much like those in a stage, but it takes them longer to learn word endings, complex sentences, and things like that. And normally, again, with subtle exceptions, by the time they're in kindergarten, first grade, they're going to be pretty much not caught up completely, but they'll be pretty not indistinguishable, but pretty much like their peers. And then with receptive language disorder, it's going to be longer. It's not unusual for them if they end up with a reading problem like my son did, then it's going to be longer than that. And then something like autism or intellectual disability, that's going to go on really pretty much. It's going to be lifelong. They're going to learn, they're going to make progress, but there's going to be differences that you're going to notice, on into the foreseeable future.
Thanks for all this great information today, Steve. We hope that you'll follow along for more podcasts. In the meantime, if you have questions for Steve, for Mary, please drop them in the comments section. Click subscribe so we can keep getting this valuable information your way. Hit the bell. And you can always check out the Late Talkers Foundation website.
And always remember, the best thing for your child is you.